Hi, this is Dr. Justin Marchegiani here, and today's talk's going to be on adrenal fatigue, kind of breaking through kind of all of the myths about adrenal fatigue and just kind of showing you the most common predictable ways patients' bodies tend to break down. The scope and how we kind of view patients' health, to keep it really simple, is really our three-body system philosophy. And that first body system really is the adrenal slash hormonal slash blood sugar systems. That tends to be the first system in the body that breaks down. And as that system breaks down, other predictable symptoms tend to occur, whether it's libido issues, fertility, hormonal imbalances, PMS, fatigue, weight gain. Again, we're not treating symptoms, we're looking at the underlying systems that when they break down, symptoms inevitably occur. The symptoms just give us a clue to the systems that are out of balance, and our goal is to put them back into balance with natural programs, diet, lifestyle, exercise, and sleep programs. So kind of looking at this here, we know adrenal fatigue is a chronic issue, and we're going to go over the physiology of what's actually going out of balance here. So again, right here, what you can see is inflammation and your blood sugar have a huge effect on fat burning. So one of the main jobs that our adrenals have is essentially regulating our blood sugar. And if our blood sugar is going up and down throughout the day, what's happening is we develop high levels of insulin after a meal and then high levels of cortisol to bring them back up. And cortisol is an adrenal hormone, so again, we're calling upon our adrenals typically 3, 4, maybe even 5 times a day to come to the rescue to regulate blood sugar. And again, if your adrenals are too busy regulating blood sugar from you just eating poorly, then they're not going to be able to help you deal with stress, potential allergies, gut inflammation, energy issues, performing well at work. So again, we only can do so many things right throughout the day. So if we can take away the stress from the kind of insidious things like eating and put it more towards focusing on family, work, and performance, you're going to just perform better. So when you can see here, when we're eating every 3 to 5 hours, ideally, and again, off the bat, eating high quality fats and proteins between meals, this is going to really allow us to burn more fat, and this is key to really having healthy adrenal glands. In the beginning, it's so important that we eat every 3 to 5 hours and enough healthy protein and fat as well. So again, this is our circadian rhythm. This is how our adrenals function. They function in what's called on a light and dark cycle. So we have high amounts of cortisol in the morning based upon the sun rising, and low amounts of cortisol at night based upon the moon and the sun setting. Again, high amounts of energy in the morning so we can get up and do what we have to do in our day, and then low amounts of cortisol at night so we can relax and go to sleep and rest. So again, we're on these light and dark cycles. So think of cortisol essentially as units of energy. All right. When you break up the word cortisol in regards to what it is, it's a glucocorticosteroid. So the first part of that word being glucose, we're helping to regulate glucose and energy. So again, the key thing there is it's helping to regulate our energy throughout the day. So as our rhythm goes up and down and all around, you're going to see your energy kind of do exactly the same thing. So typically cortisol can go high across the day, it can go low across the day, and it can go somewhere in between or normal like so. So there's 3 or 4 patterns we typically see here. And we tend to break them up into we have our normal, we have stage 1, stage 2, and stage 3 to keep it simple. And you're going to see here, the last slide was talking about cortisol rhythm throughout the day. Now, if you take all of those units of cortisol in that one day and you add it up, this is looking at cortisol sum. So it's a different slide, even though it looks like a similar curve. So don't be confused with that. So typically we're producing between 35 and 42 units of cortisol on a healthy day, and this is a healthy rhythm as well. So if you go back one slide, that's 35 to 40 units with the nice taper throughout the day. Now going here, as cortisol starts to go up, you may start to see high levels of cortisol throughout the day. So we're seeing 60, 50, 70 in that area here. So that's like it being high across the board here and then maybe dropping. So we're seeing abnormal amounts of cortisol with a rhythm that's out of whack. And now over here, normal and stage 2 look actually very similar. The big difference is the rhythm is starting to become out of whack as well. So if we go back here, normal amounts of cortisol, but it may be high here, low here, high here. So it starts to even out to look like a normal sum, but the rhythm is starting to become off. And that's a sign of what's called HPA axis dysfunction. We'll go over that a little more into the video. And then we have stage 3 where fatigue really starts to set in. Fatigue, energy issues, hormonal imbalances, depression, fertility issues, chronic inflammation and pain. And what we're usually seeing here, if we go back 2 slides, we're seeing lower amounts of cortisol throughout the day. We could see higher amounts here and then it just plummeting and being extra low throughout the day. So that kind of gives you an idea of how stage 1, stage 2, and stage 3 look. And again, typically we get all the way down here, we're looking at something like an Addison's disease, but usually we're not seeing that. The majority of people fit in a functional range, meaning they're not going to be super high like Cushing's disease, and they're not going to be super low like Addison's disease. So if you go to your medical doctor asking to get your adrenals assessed, more than likely you're not going to fit into those pathological ranges, and they're going to tell you essentially you're fine, you're normal, it's all in your head, and you're really not. We just need more sensitive tests to pick it up, not just these disease-based tests. So again, looking at our hormones, what's actually happening in our adrenals? So we have cholesterol, which is the raw material for all of our hormones. Again, it's really important. If you're eating a low-fat diet, a low-protein diet, if you're avoiding animal products, you're inevitably going to be cutting cholesterol out of your body, out of your diet, and you're basically decreasing the raw material to make these hormones. So this is like a crucial, critical step here. So again, we have stress. When stress occurs, our body again makes that cortisol. That's the first thing our body does, right? Keep that cortisol up to help regulate inflammation. When we look at the last part of cortisol, it's a corticosteroid. So gluco means it regulates energy and glucose. Corticosteroid means it regulates stress and inflammation. So the first thing our body's going to do is increase cortisol to deal with this stress here. And over time, if that stressor continues to stay, our sex hormones such as estrogen and progesterone and our androgens like testosterone are going to decrease because our body's not used to having prolonged stress. If you think back to prehistoric man, stress was, a chronic a bear attack, some type of injury or quick startle. Again, that stress was there and it was gone. But today we're having these chronic stressors, whether they're emotional from relationship issues, financial issues, work issues, whether they are chemical due to chronic insult from toxic chemicals, plastics, pesticides, heavy metals, etc., infections, blood sugar issues, or physical, meaning chronic pain, too much, too little exercise, trauma, old sports injury. Those are the three main stressors we categorize stress as. And if those stressors continue to stay and perpetuate in our life, cortisol will eventually drop out. So the goal really is to remove and address these three stressors, and that gives our body the ability to bring our hormones back up. So the old analogy I typically give is it's like driving your car with the e-brake on. You feel that pull like someone's dragging you, and the goal really is to remove the stressors, use some type of adrenal program to help restore the gland faster so it doesn't take years, it only takes months, and then it's like we release that e-brake and you just feel that resistance is just gone. So again, we have our cortisol to DHEA ratio here. So if we look over here, let's recap here. When cortisol goes low, we start to see DHEA go low. Or if we're in a stage 2 here, we see cortisol high and we see our DHEA, because our DHEA is our precursor to our anabolic hormones. So when cortisol is high and DHEA is low, we have a very high cortisol to DHEA ratio. So that's a sign that we're essentially breaking down things faster than we're building up. So the cortisol, the DHEA ratio. So let's go back here to this slide. So you can see when we have a high cortisol to DHEA ratio, all that means is we're breaking down faster than we're building up. You can see carbohydrate metabolism essentially is destroyed or weakened. That means blood sugar issues, right? We're chronically in an inflamed state. We're not getting enough good fatty acids like omega-3s and like good grass-fed meat fats. Our ability to detox goes down. We can't remove chemicals. Our ability to burn fat and protein for fuel. We're breaking down muscle faster as well. Hormone imbalances start to go out. Our adrenals are connected to our thyroid, and our pancreas is more and more stressed because our blood sugar is stressed. And again, we start seeing female hormone issues, infertility issues as well. And again, cortisol is chronically, if it's elevated, it will eventually destroy the hippocampus, which has to do with learning and memory. It'll create inflammation in the brain. It will affect sleep and our ability for our synapses in our brain to connect. And again, we're also going to see weakened muscles. So this is kind of paramount to when our adrenals dysfunction, all these other symptoms start to occur. That's why we're looking at the adrenals first and not these individual symptoms, or we'll just get lost. So here's an adrenal test so you can kind of see how it looks. You can see the person's cortisol is chronically high, 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 and then low. So that's analogous to this rhythm here being high, high, and low. So you can see rhythm is starting to go way above the range here, and you can see DHEA is getting to the middle of the range, so they're not quite in that low DHEA frame of mind. You can see the cortisol, the DHEA ratio is starting to elevate as well. Now looking at a second test, this person's in stage 3 adrenal fatigue. So you can see their cortisol level is low, low, and low. Nighttime it's normal, so it's low, low, and low. This is high normal, that's low normal, and that's where the patient is. You can see they're low across the whole day. Pretty much a flat line where there should be a nice taper there, and you can see DHEA is almost in that low range. It pretty much is there. So that's like being here, that's like being low, 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 and then normal, and DHEA is incredibly low as well. So again, summarizing everything here to keep it simple, this is kind of confusing. I'm going to break it down. So we have our brain communicating to our adrenals, our brain communicating to our thyroid. And these are the feedback loops. I mentioned the HPA or the HPT, T standing for thyroid, A standing for adrenals, HP standing for hypothalamus to pituitary. So these are the feedback loops we're talking about. And you can see our adrenals make our sex hormones and our cortisol. And our thyroid makes T4, which gets converted to T3. And our adrenal hormone, cortisol, is vitally important for thyroid hormone conversion. So again, we have stressors here, we have all the things we talked about earlier, and this actually disrupts our feedback loops, and that causes us to start producing more cortisol. Over time, cortisol becomes out of balance, and it also disrupts our thyroid glands, and we start making more reverse T3, which is essentially like a brake on the car. It slows down the metabolism, it causes us to gain weight. We get all kinds of thyroid symptoms or hypothyroid symptoms. We have all kinds of energy issues, fatigue, hormonal imbalances, infertility, chronic inflammation, and pain. So this is the typical pattern in which we see here. So breaking it all down, summarizing it all here, we have our hormone pool, right? We're either making stress hormones like cortisol, or we're making our anti-aging hormones, whether you're a female and it's more progesterone or estrogen, or if you're a male and it's more testosterone and androstenedione. Basically, these are the balance here. When chronic stress occurs, our stress levels, our stress hormone will go up. Over time, our anti-aging hormones go down. If the three body stressors or the physical, chemical, and emotional stressors continue to stay, our stress hormones eventually drop. And the whole goal is to remove the stressors so we can start bringing the anti-aging hormones back up. This is kind of the overall key. And again, our adrenals play really, really tight roles with our gut and our immune function. So you can see we have our immune cells and B cells. These are all immune cells that line our gut, our gastrointestinal tract. They typically resemble the antibody IgA. So the A stands for IgA. Think of this as the mucosal membrane barrier. So we have this barrier in our nose and our gastrointestinal tract, where this is from, and our vaginal tract, all these different tracts throughout the body that different people have. And again, when our IgA becomes low due to adrenal issues, stress, etc., we see our barrier starts to fade away. So infection, stress, inflammation, yeast infections, sinus infections, gastrointestinal infections, all these things increase. So the goal is to remove those stressors, and again, that allows our immune system to start coming back and having effect at fighting these different things. So I hope you found this talk informative. Again, feel free and visit Justin Health and get some more information regarding this. Again, you want to get your hormones assessed. That's kind of really the key thing. Figure out where those stressors are coming from, physical, chemical, and emotional. Feel free and take a look at justinhealth.com. Sign up for a 15-minute complimentary and no obligation consult. We can at least review where the stressors in your life are coming from and figure out a map to help get you from point A, where you're at now, to point B, which is you feeling good and in a better place. I hope you found this talk helpful. For any more questions, feel free and visit justinhealth.com and or call or email the office. Thanks. Have a great day.